Hello everyone, welcome to my YouTube channel. In this channel, we discuss pharmaceutics, especially now we discuss tablet topics in very easy way. Let's start today class. According to Indian Pharmacopoeia, tablet are solid and unit dosage form which is prepared by compressing of a mixture which is with excipient or without excipient. Okay, now discussion what is the type of the tablet. Tablet are different type of tablet are there. Okay, mainly we specially categorize to three types, which is oral tablet, which is swallow to our body, and another one is oral cavity tablet, which is put in our mouth. It is not swallow into our body, it is only our oral cavity. After that, another route is other route, which is different from our oral route. Okay, in oral route there is a tablet which is compressed tablet. In oral route there is a different type of subcategory are there, which is at first is oral compressed tablet, and next is here is missing one, which is multiple compressed tablet. In multiple compressed tablet there is two type. One is layer tablet, another one is compressed coated tablet. Okay, mainly we discuss multiple compressed tablet. In multiple compressed tablet, it may be a tablet compressed outside of a tablet. Okay, why this type of tablet we prefer? To increase the tablet which is present inside the tablet, who increase the tablet action. Okay, and physical stability of the inside the tablet, which is we use multiple compressed tablet. Okay, then entry cutter tablet. In entry cutter tablet there is there is some type of tablet which is degraded by our stomach acid, which is hydrochloric acid. We all know that. So the tablet are coated to resist the degradation of the tablet in our stomach. Okay, then sugar coated tablet. In sugar coated tablet, here mainly the tablet are bitter taste, then we use sugar coated tablet. Okay, in film coated tablet, the alternative procedure for our drug required coating. In film coated tablet, the coating material are mainly used to plasticizer plus the surfactant. Okay, and then next we come chewable tablet. In chewable tablet, what happened, which is put our mouth, and we mainly know that one thing we have to know, in chewable tablet there is no disintegration or use. Okay, next we go oral cavity tablet, which is put on our mouth, which is buccal and sublingual. In sublingual there is one very important drug is there, which is GTN, glycerol trinitrate. Okay, glycerol trinitrate is mainly used for the chest pain, which is angina. Okay, let's after when I teach you pharmacology, after that we discuss on here how to GTN works and all of this. Okay, lozenges and tablet. There is one type of chocolate type of things which is put our mouth, and dental cones. there is also which is put on our mouth. Then we uh, go to other routes, which is implantable and vaginal. In implantable, there is in our implant the tablet in our blood vessel, and vaginal tablet which is in there is so many infection are there, so vaginal tablet are inserted into the or vaginal cavity. Okay, there is one of another is efferent tablet. In efferent tablet, which are introduced to form a solution form and release the CO2 in high form. The tablet prepared by compressing of the drug with the organic acid such as citric acid or tartaric acid and sodium carbonate. Okay. Now we discuss on dispensing tablet. Dispensing tablet are intended to the added of volume of the water by the pharmacist or the consumer produce the solution which is given concentration. Okay. Now we discuss hypodermic tablet. In hypodermic tablet, one or more drug are readily soluble in the water. The ingredient intended to the added to sterile water or water for injection. Okay. The next is triturated. Triturated are small, usually cylindrical molded to compressed tablet, which is spontaneously used prepared by the a pharmacist. Okay. Now this is okay. Now we discussion about the diluent. Okay. Not diluent. Now we discuss on how the tablet design and the formulate. First, we discuss the excipient of the tablet which are used in preparation of the medicine. Excipient are mainly we know the medicine prepared by API plus excipient. Okay. Now we discussion. We all know that API are active pharmaceutical ingredient which has active form which is acts in our body, but excipient are inactive form of a tablet. There is no use of excipient in our body, but excipient to mainly use to a tablet proper size and to increase the viability of the tablet and the absorption of the tablet, and all of this we used excipient. Okay. Now in excipient there is several type of in tablet there is several type of excipient. At first is diluent. Okay, and next is binder, and third one is lubricant. These are the excipient which are used in our preparation of the tablet. In further we discuss on one by one. Then we used flavoring agent, disintegrating agent, flavoring agent, disintegrating agent, and flavoring agent, and sweetening agent. Okay. Mainly the I am also fully told mainly the function of the tablet which is impact our weight and accuracy and volume of the tablet. Okay, to improve the solubility of the tablet, increase the stability of our tablet, enhance the viability of the tablet. Okay, to increase patient acceptability of the tablet. Okay, so we discuss on one by one. At first, diluent. Why mainly diluent are used to maintain the proper size of the tablet. uniform size to bulkiness to the tablet. Okay, for example, preparation of most of the drug are sufficiently high that no filler is required for aspirin. Okay, and certain antibiotic. Okay, in preparation of aspirin there is no diluent are used. Okay, now we discuss the example of the diluent. In there is subcategory of the diluent. For the inorganic diluent, which is calcium carbonate, what the trade name is the calcarb and millicarb and stochurcal. Okay, stochural. Then calcium phosphate dibasic, which is incompressive, and caliform, the trade name. The trade name mainly comes in GFET and other competitive exam. We should know the trade name. Okay, especially after that calcium phosphate tribasic, it is easily to remember. Here is tribasic, so tritrab. Okay, then calcium sulfate, which is compactrol. Okay, to remember the inorganic diluent, the cool people take calcium. Okay, the mnemonic here is cool people take calcium. Okay, cool for the calcium are here is present. Okay, calcium phosphate. Okay, takes tribasic calcium, here is calcium. Okay, to remember diluent, the mnemonic is here. Okay, then we discuss about the cellulose diluent. Diluent first come with mnemonic my cell made silky. Okay, mime for microcrystalline cellulose, which is MMC. It is also used as disintegrating agent. Okay, so it is mnemonic is abyssal. It is before comes in, there is so many competitive exam. There is GPED also. It's comes what is the proprietary name of MCC, which is microcrystalline cellulose. Okay, and then cell, here is cell 2, here is remember abyssal. Okay, in med we remember the MCC. Okay, MCC silicified, it is called propsulf. In silky we use sulf. Okay, now the group mnemonic sugar or group mnemonic is here. Okay, now we discuss on sugar or polysurf, which is dextrose, which is called Imodex. This is also before comes in exam. Okay, in dextrose, that is paraffin. In fructose, there it is fructofin. Okay, in lactylol, that is phenac. In lactose, there is tabletose and pharmatose. In lactose, one thing I told you. Okay, here we discuss concentrate here. Okay, lactose is two type. What is hydrous and another one is anhydrous. What happened when lactose diluent we use it in preparation of the tablet, that amine containing drop react with the lactose. For the example, amine containing drug, that is isoniazid. Okay, isoniazid, before it's comes in our GFED exam. Okay, isoniazid. Okay, then amine, what is in presence of magnesium citrate, but for any metal citrate. Okay, for example, we takes in magnesium citrate. Okay, that is furaldehyde is comes, or the final product is furaldehyde, which is dark brown in color. Dark brown in color. This reaction is called Maillard reaction. Okay, this reaction is called Maillard reaction. Maillard reaction. So mainly in amine containing drug or lactose are not used. Okay, so lactose is mainly in low cost diluent which is used our preparation of the tablet. It is the most suitable diluent also. Okay, now we come maltitol, which is maltosur, and maltodextrin, which is glycidic. बहुत main thing is that there is so many diluent and so many trade name. Okay, so mainly important are we have to learn that. At first we discussion, then I tell you what are the important. Maltose is adventose, and malitol is fetriol, and sorbitol the sorbitab, and sucrose there is no proprietary trade name in sucrose. Compressed sugar, this is difac and newtab, and sugar spirits, this is nucor and nuvarelli. Okay, then xylitol, this is xylitab. Now we discuss about starch. In starch, okay, sorry. The starch, the pre-gelatin starch, which is starch 500 or pre-gel. Here is mainly important three thing we have to know that. First is microcrystalline cellulose, what is proprietary name is AVCL, and we have to know that dextrate, which is proprietary name is MDEX, and another one is lactose, that is a tabletose or pharmatose. Okay, then we have to know compressible sugar, which is difac and newtab. Then another one is pre-gelatin starch, which is starch 1500. Okay, so mainly 5 to 6 diluent we have to remember with his proprietary names, or the trade name of the diluent. Okay, now we discuss about the mainly disintegration of the tablet. Mainly disintegration to know that to break down of the tablet in contact of the water. When the tablet comes into contact to the water, the tablet break down. There is so many mechanism to break down of the tablet. In tablet, there are disintegrator swell the tablet, absorb the water and swell the tablet. So it is that active pharmaceutical ingredients come out. Okay, mainly super disintegrate are swell 10 to 10 fold. Okay, the super disintegrant are 10 fold within 30 seconds. Okay, in contact of water, so there is super disintegrant. Here is for example, cross pavidon is a super disintegrate, cramulous sodium is super disintegrate. Okay, then CMCNA also a super disintegrate. Okay, then okay, let's discuss another there's a disintegrate with its proprietary name. Okay, and here is mnemonic are there. Okay, first we discuss mnemonic. A smart child makes clever doctor get many marks properly. Smart student study perfectly. This is the mnemonic. This is the first word of the our disintegrant. Okay, A for alginic acid. Okay, smart. We pick the first word. Okay, for it is sodium alginate. sodium alginate, which is proprietary name is monocal. Next is child, which is for carboxymethyl cellulose, which is sodium CSC, CMCNA, what is a AC disol and soluble. It is also more important thing before it's comes GFAT. Okay, ABCLR before we told it is also a uses a diluent also. Okay, cross pavidon, it is calidon Cl and propylplaston XL, and another is cross camalose sodium, which is acid dissolution. Okay, and then decused sodium, that then is guar gum, and magnesium aluminum silicate, which is we proprietary name is vgum. It is also most important. Methyl cellulose, methocell. Okay, pyrrolene potassium, which is ambrylide, and polix PO. Okay, then sodium glycine carbonate, which is apical, and which is apical sodium starch glycolate. This is explotab, and primicell starch primulase starch, which is selective, and pharma gel, which is precell, and precell, and sapistaf. Okay, now we discuss some about the next excipient. Okay, which is lubricant. Lubricant are mainly used for the prevent the adhesion of the tablet material, which is surface dye sponges. Okay, to dye sponges to reduce the interparticle friction and improve the rate of flow of our tablet. Okay, now we discuss on lubricant to calcium citrate, fumaric acid. These are lubricant, which is glyceryl bayonet, and glyceryl palmicetrate, which is proprietary name is Parcerol, and another in hydrogenated vegetable oil, which is Lubritab, and magnesium lauryl sulfate, and magnesium citrate, PG 400 and 6000, sodium lauryl sulfate, which is apical, and citrate weight, and sodium stearyl fumarate, which is proof, starch, stearic acid, and talc, and zinc citrate. Okay, now mainly we come into glidant. In glidant, which is promote the flow and material, which is reduce friction between the interparticle. The particle of the, when preparing the tablet, the granules are there. They are reduce the friction between the granule. It is granules that we use glidant. This is the example of the glidant. Okay, here is mnemonic are there. Cool children make silly smooth tablet, cool for calcium silicate, and children for calcium cellulose powder, and max for magnesium, C for carbonate, then M for magnesium oxidate, then magnesium silicate smooth, then tablet, S for smooth for calcium dioxide, then tablet for talc. Mm, okay. Now we discuss 1 minute. Okay, sorry. Mm, One emergency call from our college. Okay, okay. Let's start discussion. Now gradient is over. After that we discuss. After that we discuss binder. Okay, binder is this material which is added to either dry or wet form of a granule to form the cohesive compact of the directly compressed tablet. There is so many example of the binder. Okay, there is so many example of the binder, which is here only, which is carboxymethyl cellulose sodium, which is proprietary name is nemicell, and cellulose, which is microcrystalline cellulose, which is abyssal, amphocyl, and vivacell. Then another one is ethyl cellulose, is aquacot, and HPMC, hydroxypropyl methyl cellulose, which is called our methocell, and pharmacot, magnesium stearate silicate, which is otherwise told in pharmasop vimigam, and another is methyl propyl cellulose, which is cellulose, and methyl polydextrose, which is latex. Okay. Now we discuss on what is the preparation of a tablet. Now we discuss on the manufacturing of a tablet. Okay. Now we see a new sheet. Okay. Tablet manufacturing involves especially several types, but now we mainly discuss about three types. Okay. In three types, at first is granulation. In granulation, second is compression, and last one is coating. In granulation, there is most famous method is wet granulation tablet and dry granulation. Okay. Now we discuss wet granulation. In wet granulation, there is several steps. In first step, what we do in step 1. Okay. In step 1, we discuss the miling of the active ingredient, the excipient of a homogeneity of the final granule. At first there is active ingredient, which is API, which is that we are milling. Okay, then excipient also milling. In step 2, we are proper weighing of the API, also our excipient. After that, what we do in step 3? In step 3, we are mixing. We are mixing the excipient with our API. Okay. For example, the mixing are used for a double cone blender. Okay. Double cone blender, and second one we use the V blender. Okay, V blender. Okay, and another one we used the ribbon blender. Okay, ribbon blender, and next one we used for the mixing of the tablet and API, which is planetary mixer. Planetary mixer. Okay. After, in step 4, we use the wet meshing. In wet meshing, the tablet granules form are binding the powder together. Okay, that in step 4, the binder solution are added. In step 4, what we do, binder solution added slowly. In added of binder solution, there is two method are used. In method 1, what we do, the drug plus the diluent, and used, then dry binder are added. In method 1, what we use, dry binder are added and blended uniformly. Then after that, suitable solvent to use to active the dry binder. Okay, but another in method 2, what we do, in method 2, drug plus diluent, then binder solution are added. In the mixing of binder solution, there is 4 steps are there. In first step, we called pendular. In pendular step, there is the particle of the tablet. We added little much of the water or a suitable solvent, then the particle are aggregate to each other in pendular step. In next step, funicular step, we add the more water used, then the bridge between the tablet are formed. Okay, in capillary, and third is capillary. Okay, in capillary, that is particular in form of a circle form. Okay, after that droplet are formed. Okay, in GFET also this mechanism are asked. Okay, here is we saw pendular form, funicular, then capillary, then droplet. Okay, then discussion why weight granulation is preferred. Drug has poor flow. Okay, drug has poor compressibility, high dose formulation, content uniformity is critical. When it is why when we why in some case we do not prefer our weight granulation. Okay, when it is not prefer, at first moisture sensitivity drug, heat sensitivity drug, cost sensitivity formulation, in which we do not use our weight granulation. Okay, now we come dry granulation. Okay, in dry granulation, what happened, the API which is sensitive to the heat or moisture, we use the dry granulation. In dry granulation, the step is at first we do milling. Okay, milling. In second we weighing, proper weighing of the tablet and excipient. After that we screening the mixture, then we blending proper mixture of the tablet and excipient. After that we prepare slug. Okay, slug. Then the dry granules are formed. What happened, the dry granules are formed. Then what happened, we use lubricant. Okay, we use lubricant, then directly we use compress. For example, in dry granulation, this is aspirin and paracetamol, ascorbic acid, sodium bicarbonate and potassium chloride are used. Okay, then the when compress the tablet. Okay, to compress the tablet, there is basic component of the compression machine we discuss. At first it is in head. This is our discussion about our component of our machine. This is head, and next one is body, and third one is hopper. Okay, and fourth one is dies. Mainly define the dies, what the uses of die mainly define the shape of the tablet. Okay, you write dies only mainly define the shape of the tablet. Okay, then punches, punch, what the uses of punch the compress with the die to form a tablet. Then construct the guiding the movement of punches. What doing construct is doing, guiding the movement of punches. Okay, okay, it's before come in our GPED. What is the use, what the chem track doing. Okay, now we discuss on tablet coating. In tablet coating, there is several type. First is sugar coating. In sugar coating, to prevent our moisture penetration to the tablet, mainly alcoholic solution and shellac are used. In soft coating, the roundest edges are used. Okay, in soft coating, the round edges are built up tablet size to increase weight 50 to 100%. Alternative coating is binding solution, dusting powder, The smoothing is mainly to subcoating. Okay, and in smoothing we use colorant are used. Okay. um, Compress color coating impart our elegance and the uniform color of the tablet. After that, polishing to fine the tablet. After that, we do printing. In printing, the proper name of the tablet, we print our tablet. Okay. The here is the step of the sugar coating. Mainly sugar coating are sealing, subcoating, syruping, finishing, and polishing. The coating material are used for the sealing is shellac to tablet disintegration time increase. Okay, for subcoating we use gel to alcohol soluble protein derivative are used. For syruping, uh, regular syrup are used. For color stabilities and finishing, 3 to 4 are regular 3 to 4 regular syrup are there to colorant to enhance elegance. Polishing, B-Ways convex and done convex with polishing pan. Okay, now we discuss on mainly defect of the tablet. Okay, now we this page are new page are come. Okay, defect of the what we discuss now, defect of the tablet. Okay, defect of the tablet. In defect of the tablet, this is visual defect. Visual defect. In visual defect there is mainly 3 types. In visual defect, what is mainly, it is process related defect. In process related defect, that is comes capping. Okay, here only here. In process defected comes in capping, lamination, cracking, and chipping. These four are process related. Okay, process related. Okay. But sticking, picking, and binding, these are formulation related defect. That is formulation related defect. And double compression, this is machine related defect. In capping, what happened, the tablet, what is top or bottom is completely or partially separate. Why these defects are come? Because of entrapment of air, low moisture content of the granules, it's come. What is the remedy, how to increase our benefit for the minimize the defect of the capping? It is comes to use a proper binder. Okay, after that, lamination. The tablet are split to 2 to 3 horizontal layer. Okay, the tablet are split 2 to 3 horizontal layer. It is also due to air entrapment and excessive force are used. When the tablet compress, with the excessive force are used, so that the tablet are splitted into 2 to 3 layers. Okay, what the remedy we are used to minimize the problem, the defect? What is this is the reduce compress pressure we can reduce. Okay, after that, cracking in the small crack the surface. This is a tablet, this is the cracking, these are cracking, the surface cracking. Okay, why it is comes? It is come for rapid drying. Okay, when we rapid drying of the tablet, the crackings are. So how to modify the problem to drying condition, modify the drying condition. Okay, to decrease the drying condition. Then chipping are, what is the breakage of edges? These are tablet, these are mainly edge of the tablet, Okay, the breakdown edges of the tablet. why the breakdown edges of the tablet to insufficient. Here also insufficient of the binder. Okay, so increase our binder. Sticking the tablet are when stick there excessive moisture are there and tablet are not properly drying. Okay, then the tablet are what happened, it is stick to the punch space of the dies. Okay, dies. So we reduce the moisture and anti-adherent are used for picking when the tablet remove from the tablet surface is stick to punch. Okay, it is also sticky material or causes of the picking. What use you added to lubricant to reduce the friction. Okay, in binding the tablet are stick in the wall, the insufficient lubricant are present, then increase our the lubricant concentration. Okay, malting that you help to remember malting in color, that is o is there, here also o is there. Okay, to remember malting is used for malting is the defective when color defect is we call malting. Then proper mixing to immigration of the dyes to use proper proper colorant. Okay, hard variation, that is non-uniform of the tablet. Okay, why the hardness of the variant for the tablet and the flow property of the granule is poor, so it is insufficient. Weight variation, proper flow of the granule, for flow of the granule, then it is the variation comes, what is weight variation. Okay, now we discuss the evaluation of tablet. There is it is two type, non-official test and official test. Before in our exam is GFAND and NIPER. The NIPER one question is there, please find out to what is the official test and what is the non-official test. In official test is called weight variation, content uniformity and dissolution disintegration. But in non-official test, this is general appearance, hardness and friability. In friability tester, these are the friability tester. In friability tester, what we do at first, okay, we take a blank page. In friability test, we take mainly 10 to 6 tablet, but mainly 6 tablet. Okay, we take at first 6 tablet. Weight of 6 tablet each of the tablet. Okay, then sum of the tablet. After that we put in our friability. It is rotated for 4 minutes. Okay, it is not important thing, you should be remember for this. It is 4 minutes and its speed is 25 rpm. Okay, here is 25 rpm is the speed. Then after 4 minutes the tablet bring out, and we then we wear the tablet, and then we get some of the tablet. Okay, the mainly for friability, the how to friability calculate, the formula is W1 minus W2 divided by W1 into 100. Okay, into 100. W1 is initial weight of the tablet, initial sum of the tablet, and it is the final sum of the tablet divided by initial sum of the tablet into 100. That it always comes less than equal to 1%. Sorry, greater than equal to less than, right, less than equal to 1%. Okay, now we discuss the weight variation. Here here is weight variation. Okay, now we discuss is weight variation. In weight variation we select what, here only we talk. In weight variation we select 20 tablet. What happened? 20 tablet and weight individually of the tablet, then average, we calculate the average, what the sum of the all tablet by 20, we get the average of the weight. Okay, for example, for average weight is 300 mg. Okay, average weight is 300 mg of a tablet. In 300 mg it is 250 mg or more, 300. So the limit is here is plus minus 5%. Okay, in 5% of 300 is 15 mg. Okay, this is 15 mg. Okay, so the allowed range is 315 285 to 315. That is the average allowed range for the pass the weight variation. Okay, now we discuss content uniformity. Okay, content uniformity, we take 10 tablet. Okay, what we take 10 tablet. In 10 tablet the dissolve into the a proper solution, solvent to prepare solution. In dissolve in solvent we perform in HPLC or UV. Then the formula for content uniformity is the percentage equal to amount of found, for the HPLC, some the amount of the drug were found divided by the label we claim. Okay, the label we claim, the B.Pharm in pharmacopoeia, that is several content uniformity level. Okay, label we claim into 100. Okay, it should be 85% to 115, 115%. This type of variability is acceptable. Okay, more less than 85 or more than 115 is not allowed. Okay, now we discuss on disintegration. In disintegrating time for uncoated tablet, it is 15 minutes. Okay, 15 minutes. For film coated tablet it is 30 minutes. For sugar coated tablet it is 60 minutes. Okay, then enteric coated tablet, for enteric, here we take, for enteric coated tablet it is 2 hours. Okay, for dispersive tablet it is less than equal to 3 minutes. Okay, and another one, effervescent tablet is less than equal to 5 minutes. Okay, the okay, last is dissolution. Dissolution is the process in which the solid form of a tablet or the liquid form of the tablet or a suspension and liquid form, not tablet, liquid form of the dosage form. Okay, it's got to its solution form, and these are the dissolution apparatus. Okay, for the Indian pharmacopoeia, that is used pedal and basket. Type 1 is pedal, type 2 is basket, but in USV it is opposite. In typeword we use basket and pedal, and for British pharmacopoeia it is basket and pedal. For type 3, according to USB, it is reciprocating apparatus, and according to British Pharmacopoeia, flow through the cell. Type 4, it is form according to Indian Pharmacopoeia, flow through the cell apparatus, and USB flow through, it is also same, flow through cell apparatus, and British Pharmacopoeia it's also same. And USB, the type 5 is pedal over the disc, and type 6 is rotating cylinder, and type 7 is reciprocating holder. Okay, here is bowl is there. In bowl, the buffer or another solvent you use, it is 900 ml. Okay, 900 ml. Here is a temperature we have to maintain, it is 32 degree plus minus 5. Okay, the temperature we have to maintain. Okay, thank you.